Publication of secondary analysis from reduced trials in the critical care. My name is Joana Ruiz López, teacher licenciado John Moscoso. Issue applied in Ecuador. Some studies show that adverse events and incidents are frequent in UC, with incidence between 1 and 32% according to the series and the method used. Virtual and critical patients will be exposed to error. This will occur 2 weeks and the day per patient, and 1 in 5 patients in the UC will suffer and the serious adverse event.
Why do we spend so much on healthcare, both individually and as societies? Because we think the healthcare works. But how do we know that? For some drugs like penicillin, when it was first introduced, it was obvious that it was effective. And for some treatments like appendicectomy, it's long been obvious that if a patient had appendicitis, surgery would almost always save them from death due to peritonitis. But for most treatments, for most diseases, the effects were less dramatic. And so it's not so obvious that the new treatment was more effective than an old one. And so we imported from agriculture randomized trials as a technique for evaluating interventions to tell us whether or not they were effective. To do a randomized trial, we formed 2 more groups that are alike in every factor that might affect the outcome of treatment, except the treatment itself. One group gets a new treatment that we're interested in, and the others get an alternative. It's an older treatment, perhaps usual care, perhaps an inactive placebo. Because the groups are otherwise identical, any difference in outcomes is then due to the difference in treatments. So, if the treatment group did better, then it's the treatment that's responsible for that improvement. And smaller effects. And in order to make our trials sensitive to these small differences, we started to eliminate the patients whose conditions, perhaps they had several conditions, or whose advanced age or less than perfect adherence to their medication might even slightly reduce the impact in deciding whether or not to implement a
Definition. A clinical trial is controlled experiment in human volunteers used to evaluate the safety and the efficacy of treatment or intervention against disease and health problems of mankind, as we as to determine the pharmacokinetic or the pharmacodynamic effects of novel therapeutic products, including the studies of their adverse reaction. Application in nursing. Conduct period intakes of the UC, the analysis which analysis approved the safety incidents that have occurred in the UC and the specific to establish preventive measures. Care of a risk analysis of those the process that may pose an greater risk in the UC in order to identify possible risks of the failure that might exist and the preventive measures to prevent it of or mitigate the occurrence. Pros and cons. The main event is that the experiment maneuver in the independent of prognostic determined. On other hand, the real possibility of carrying out the experimental studies can be a serious compromise for reason on the practical logics.
Randomized control trials have been used mostly in medicine. They've become very, very widely used in economics, but also in other social sciences. Evidence-based policy is one of the magic words of the day. And while everybody thinks evidence is a good idea, what we argue is that the social status attached to control trials, even a lot of people think they should have social status, and that evidence from randomized control trials come out another evidence. Usually, for instance, when we do economics, you have to control for other things. So if someone has more money than others, they behave differently. It might be because they have more money, they have more education, they might be a man versus a woman, they might be lots of different things. A trial like that, or in another environment. In the randomized control trial, the thing is that if you're going to be serious about using them for policy, which is what people think they're going to do, you have to ask the question as to when you do the experiment, how do you transfer the result to the policy setting? And for that, you have to think about that before you run the experiment.
Conclusion. When you say clinical trials are the close studies to the experiment methods so they form the paradigm of epidemiological research. They represent the stage with the highest level of causality where the investigator has control over the exposure and are prospective. Their practice, however, is very complex and in the developing countries priority must be begin in addition to methodological aspects to ensure the rights of patients. Thank you.